in one of the most advanced medical centers in the country, performing among the most complex procedures. Patient safety in every aspect of patient care throughout the UCLA health system is paramount.
UCLA's mission is to provide exceptional care without exception. Quality and safety really is the foundation of achieving that goal, and safety is probably the most important part.
Can you tell me what procedure you're having done today?
It might seem annoying that the same questions are being asked over and over. What's your name? What procedure are you having done? But it's just really important that we have the right patient, that we're doing the right procedure.
The surgical site markings, checking that, going through medication lists with patients.
So I'm just going to mark your left side to identify that we're going to be putting your kidney on the left side. Okay.
Asking them why they're here, and they'll always usually look at you and go, don't you know? Yes, I know, but I need to know your understanding of what's going on today.
And nothing over the counter, no Tylenol, Motrin, anything else you might have had.
We're very careful about every detail, and we have a series of checks so that you know, the pre-op nurse checks, the OR nurse checks, the surgeon checks, and the anesthesiologist, they all do their own checks.
And make sure that you're comfortable.
I love those.
Safety before comfort, but we want both to happen in there.
Safety is number one to, I think, every staff member here.
Very, very good care of her, and we'll see you in a little bit. Okay.
The patient has placed trust in the entire institution. The surgeon is ultimately responsible for everything that happens in the conduct of the operation in the perioperative period, but it's a trust that's been placed in the institution, and for that reason, we as an institution take safety very seriously.
And the way we've gone about doing that is by putting systems into place.
Charles Francis Haverstick, February 6, 1957.
Which I would do. To make the hospital the safest it can possibly be for the patients who've entrusted us with their care.
Borrowing from safety checks in the airline industry and NASA, detailed checklists are performed in the operating room for every case.
Let's go through the checklist. Let's make sure that we have the right patient, that we have the right procedure on the correct side. We have all the instruments and everything that's necessary to perform the procedure, and that we're ready to go.
Here at UCLA, we're recognized as one of the world's best in terms of quality of care and safety. But this just doesn't occur by chance. We've put in place many different programs and practices to make sure that we're doing well. We need to make sure for every patient we deliver care that's at the highest level of quality and safety with compassion and concern.
We've been doing elements of this checklist for many years. What's new is that the elements of that checklist are expanded and include a very important feature, which is that the individuals actually introduce themselves at the beginning of every case, and that the surgeon briefs the entire group on what's going to happen.
I'd like the team members first to introduce themselves by name and their role.
So we talk about allergies to medications, we talk about the necessary equipment being present, we talk about whether blood is needed. So these are things that in the past we used to assume everybody was on the same page. Now we guarantee that everybody's on the same page.
In addition to exceeding national safety standards, UCLA is home to one of the most advanced, state-of-the-art simulation centers in the country.
Well, the situation has improved. What did she do, Jamie?
She did a cric. She did cric with her.
Recreating ever more complex cases in lifelike labs, dedicated to assuring and improving performance and the highest level of patient care.
Being in an academic environment, we really want to not only have the minimum standard, what's expected at the level of any healthcare provider, but for an organization such as UCLA Health System, we really strive to be not only the top hospital in the country, but we also have a goal to be the best healthcare provider in the world and to be a provider of choice for our patients.